Hello, guys and girls. The program you are about to hear will be both fun and educational, but it is not a substitute for medical advice. Although we are doctors, we are not your doctors. Hello and welcome to Travel Medicine. As always, I'm your friendly neighborhood internal medicine doc, Dr. J.
Hey guys, Santhosh here, your pediatric infectious diseases doc.
And this is Praz the Sandman, making your craziest dreams come true through the radio waves.
You know, he hasn't actually repeated himself.
Not once. He
Five
has
episodes going strong.
a different intro. He's like Bill Curtis from Wait, Don't Tell Me. He's got a different intro every time.
That's how you'll know when I try and sneak a repeat in on you.
Curtis with Travel Medicine Radio. I love it.
Yeah. Wait a minute. Praz used that one back in episode 214.
This week, I wanted to do something a little bit. I feel like we've been very superficial lately. I wanted to go a little bit deeper, so I decided to do an episode all about cosmetics.
Yeah. Keep it skin deep. Just keep it skin deep.
Under my skin today.
But you know, we're also in one of those weeks when I like to round up all the journal stuff. So it's time for another journal club. Yay!
Yes.
Santhosh, do you remember when we discussed previously ancient Egyptian medical papyruses? Papyri?
That's right.
Papyrodomuses. Yes, I remember, and we had a lot of fun talking about a little bit of psychology, a little biology. We talked about condoms.
And one of the things, of course, we always think about is the black eye makeup when you think of ancient Egyptians. Usually people immediately go to hieroglyphics or that Bangles Walk Like an Egyptian music video.
Yes, the black.
Or both.
Yeah.
And that black eye makeup, which is known as kohl, actually may have a medical purpose. Now, it gives the chemical composition or recipe for it in the Ebers Papyrus, but in a paper published by the American Chemical Society actually noted that lead-based substances were used for medicinal purposes and that large doses of lead, as we've covered, are poisonous, but microdoses can stimulate specific aspects of your immune system through nitrogen monoxide, and it may have helped to combat eye infections in a swampy area or a marshy tropical area such as the Nile, where any kind of droplet contaminated with bacteria in water getting into your eye can cause, well, a whole host of problems for people who depend on that one water source.
Sure, and this is just a property of lead. It's quite toxic to really any cell. It inhibits the firing of chemical impulses which depend on other ions like sodium and calcium. So bacteria depend on these chemicals too to communicate with each other, to move around, to invade, and to infect. So it's a little toxic to your skin, but and to your brain, and to pretty much
you look fabulous.
But perchance it will also kill any invading microbes as well that it comes in contact with, because we share at least that much with our distant unicellular relatives.
Sub-micromolar concentrations of lead ions, so not the full compound, but lead ions used sparingly.
Right. Not caking it on there. you want a light touch.
Even in caking it on, it's in trace amounts. Like I believe, isn't there some charcoal and zinc in the football eye makeup?
It is, yeah. The eye black that they don't. Football players don't wear it for that.
Silver.
So and these heavier metals also have likewise these antimicrobial properties. We're even now in this day and age considering coating surfaces with less toxic metals such as silver and copper, because inherently bacteria have a hard time growing on these metals. Yeah, and we can use those metals on things like door handles and railings without worrying about us going crazy and dying.
A small price to
A
pay.
small price.
It's interesting. I see, like, that when you say that this lead increases production of this chemical nitrous oxide, nitric oxide, I should say.
Nitric oxide, exactly.
Yeah. I wonder if part of the immunomodulant properties is that by increasing blood flow to that area, you also increase delivery of oxygen and other antibacterial agents that are innately found in the blood.
Sure, so you're talking about INO, nitric oxide, that is a natural vasodilator, right, Praz?
Mm-hmm.
Yeah, so this is something that our body makes in order to increase the diameter of our blood vessels, so vasodilation.
Mm-hmm.
And wherever you deliver blood, white blood cells come along, and other antimicrobial proteins like complement. So yeah, that could absolutely be just increase the blood flow, and your own natural defenses go and kick some butt.
Although, of course, that wouldn't work on doorknobs, but definitely on
So far, we can't put blood flow in our doorknobs.
I mean, I would never leave my house.
No.
That would just be...
Oh, yeah. Josh, the doorknobs are bleeding again. What?
Man.
Call the...
No. Look, I can deal with the walls bleeding, but seeing actual pulsing arteries and veins in a doorknob,
That's
so
like
creepy.
some,
that's where I draw the line.
So creepy.
Yeah, that's like some horror movie stuff. Right there.
Yeah, that's some horror movie level madness.
I can imagine way in the future, the travel medicine podcast in, the year 3017. As like, back in 2017, an intrepid group of young doctors suggested making the walls bleed in order to prevent bacterial infection. And now, it's common practice. I mean, why didn't we think about this before?
We're the racist old grandpas who hate the meat walls.
In my day, they were made of cinder block. I feel, crazy old Josh.
From the brick age.
From the brick age.
All right.
All right.
Well, gentlemen, I figured that'd be a fun place to start. And now let's move from cosmetics into cosmetics.
Aha!
And start
I
talking.
don't get it yet.
Nice.
About some of the journal articles where medical technologies are being used to help improve our outward appearance.
Mm.
All right.
There are some really fun ones I got for you this week. We'll start with a urban legend that has been proven true on one or two occasions, and that is, I'm sure you're all familiar with the concept of a lazy eye.
Sure. Eyes just lazy.
They're not lazy, they just need to
Known
be whipped into
as-
shape.
Yeah.
Yeah, well, the medical treatment for it is usually wearing a glass or an eye patch over the affected eye or over the good eye,
Right.
forcing the lazy eye to work harder.
There you go.
And get with the program. And there has been an urban legend for years that seeing 3D movies wearing those red and blue old-timey stereo goggles could correct it. And now there has been an actual case report of somebody who went in wearing these glasses and came out with his lazy eye fixed.
Huh.
So the gentleman is known as Ben Bridgman. He went to go see a 3D showing of the movie Hugo. So this is, again, a little bit of an older story, but it came up in Popular Science.
Okay.
But he had his whole depth perception restored, according to both BBC and later CNN.
Okay.
And this is not to say that, you should grab your 3D goggles and go see Assassin's Creed or Star Wars to fix anything medically wrong with you. But
Won't fix your diabetes.
Yeah. So, go ahead.
no, please, Santhosh, explain what the theory behind this is and how it works.
Well, so you have an issue of stereo blindness here. So, the people who have this form of lazy eye is, and medically we should use the term, it's called strabismus, where one eye doesn't line up properly and move well when the other eye tracks. And you can have several reasons for this. If you have a problem where you actually have a nerve that doesn't work, so there are several of the cranial nerves involved in coordinating your eye movements and moving your eye properly. If there's a problem with the nerve, if there's a problem with the muscles that actually pull your eye into alignment, this may not work. But if the issue is just that maybe from a very young age, the eye has not been aligned properly, because it was initially set wrong, because the way that your muscles around your eye, so-called extraocular muscles, were not lining up the eye properly, then you can kind of teach them or train them to work. So this is in a very specific type of strabismus. And essentially what you need to do is get the communication from your eye muscles, and your brain, which kind of sets up a framework for how things should look. And this is a teaching. You're teaching that occipital lobe in the back of your brain how the world around you should appear. And if you can do that, then what happens is that the brain communicates back to the extraocular muscles via the cranial nerves and pulls your eye back into alignment with your dominant, or I shouldn't say dominant, or with your good eye. So this is a case of using technology, a little bit like how a little while back we were using roller coasters to fix kidney stones. We're using, fun technology like 3D movies to teach a lazy eye, an eye where you have strabismus, to pull back into alignment and look where it's supposed to look, so that your vision is no longer double in particular cases. So most people with strabismus will say, when I look to the left, everything's fine, but if I look to the right, I'm having trouble looking over there, or when I look down, or when I look up. So definitely, first and foremost, you should go to an ophthalmologist or a neurologist who can make sure that the muscles are all intact and the nerves are working well. And if it's a true case of just quote-unquote simple lazy eye, then it's possible that therapies like this can work.
Even with that being the case, I'm surprised that just one movie was able to fix this guy.
Yeah, there's got to be a little bit of...
Well, that's why he's a case report.
Yeah, just a singlet.
And the reason I bring it up is that studies are now being done. In most people, it does take, at the very least, a matter of months.
Right.
So not hours. Now, that time can be shortened if the person is young enough, because the brain does have more plasticity.
Sure.
Right.
But studies are being done at how 3D works on your brain. And as 3D technology gets better, we're essentially always training our brains. And the length of a 2.5-hour 3D movie with amazing technology could eventually point toward a quicker treatment if the technology catches up with us.
Right.
But in the meantime, we'll have to stick with the traditional treatment of looking like pirates, and I don't mean of the Caribbean.
Aha!
So that was again, older story with a developing technology, but let's start getting into something a little bit more modern and cutting edge.
Oh yeah, cut and slash.
Yeah.
And this is actually more in your world of operations, Praz.
Okay, yeah.
Because it is an operation.
Oh.
do
you all remember the song? And I loved that this was used as the clickbaity title. I wish I was a little bit taller.
Yeah.
I wish I was a ball.
Yeah. Wish I was. Yeah, that was Skilo. Are we allowed to say that? Do we have the rights?
Well, we didn't have a beat, and we're using educational purposes, but full credit to them.
Yeah.
So, there is actually a real, honest-to-goodness, legitimate surgery that can help you grow up to a full foot in height. But before you run off,
oh God,
let's go briefly into the world of orthopedic and cosmetic surgery. And Praz, you want to tell us about this one, as with your unique anesthesia perspective of having to keep somebody unconscious for this?
Well, let's full disclosure. I've never actually seen this in person, but it sounds like it would do quite a lot for a lot of people. Not as much for me. You guys can't see me, but I'm a relatively tall gentleman.
And handsome.
As tall as I am, muscular, and Santhosh is kind.
Oh,
Exactly.
it's just
All
there. I don't think there are enough superlatives. Should we move on? I feel like we should move on.
We could go on forever about your superlatives. With this procedure, I mean, it seems like it would do a lot for a lot of people. There's a lot of people who just are not only born with dwarfism, but also people who have one leg that's a little bit longer than another, people who limp because of that, or who are unsteady for that, and people who deal with a lot of bullying because of this issue really don't have very good quality of life. And this one surgery can certainly do a lot to fix that or to change things for a lot of people. Basically, the way it works.
Well, first, I think you have to make a couple unwise gambling moves, and then you default on your loan shark.
Oh.
And then the bookies, and then he sends his bookies, who will call orthopedic surgeons, to break your legs. And I think that's the first step in the surgery, more or less. Am I correct?
Basically, yeah. I mean, it's a big deal to like break something that's intact and try to refix it, because there's no guarantee that things are going to heal the proper way or that you'll even have reasonable function afterwards. You primarily do it if things are that bad or your quality of life is just that poor. They take the bones, they break them, they put rods in, stretch them, pull apart all your nerves, arteries, the skin. You're taking a big risk, a 3-month risk, before you actually even see the results. Generally speaking, it should add about a few inches, but I mean, in extreme cases, if someone's really feeling lucky, as you know, like you said, sometimes it could add even as much as a foot. If you get a spare snake eyes, though, I wouldn't count on it.
This is something that we've known about for a while in terms of lengthening. So let's give a small anatomy lesson, first of all. So you got your hip bone connected to your thigh bone. Your thigh bone's connected to your shin bone. And your shin bone's connected to your ankle bone.
Is that also a Skilo song?
I think that was Tupac. That one.
I remember that one.
Yeah. So you have your thigh bone, which is called the femur, and your shin is actually made up of two bones, a little bit like your forearm, called the tibia and the fibula. And in this particular case, Josh, I think we're talking about lengthening with the tibia and fibula, right? So
correct.
This is one that we in pediatrics have known about for a while, where you make a break in the middle of the bone, and then you fix the bone above the break with think of a metal ring that goes around, and then the spokes of the ring drill down to hold the bone in place. And then you have another ring which is below the break, and again the spokes go into the bone. And then you have a rail that connects the two rings, or several rails actually, and you actually give the patient a little tool. You give them a little ratchet, and they're supposed to turn it like a quarter of a turn or a full turn, once a day over a long period of time. And we've used this for limb lengthening when there is a drastic difference between like the right and the left leg, which can happen in growth with some kids. Sometimes this happens because of a defect that they're born with. Other times it'll actually happen because they may have had a fracture at their growth plate in the tibia or the fibula or the femur, and the bone actually ceases to grow properly. In another case, or another type of case, you can think of a clinical disease called Blount's deformity, where the bone is actually bent out of shape, either because the patient is overweight or the bone actually grows improperly. So the bone has to be broken and then either lengthened or shortened and then reset into place and allowed to heal. But it's kind of miraculous that you can like pull the bones apart like that, and then your body knows how to fill in the space with more bone. That's just awesome.
So I've got two fun little bits of history for you about. The first is about that technique which you just described.
Right.
And it's wonderful. I know I talk about how scientists are bad at naming things, but doctors, and I know we're giving ourselves a little bit of a pat on the back here, are great at naming, because this is known as distraction osteogenesis. Osteo meaning bone, genesis meaning creation, distraction meaning, oh shit, what's going on? So this technique is known as distraction osteogenesis. And distraction osteogenesis is exactly what Santhosh has just described, with the turning of the ratchet to maintain tension on the bones and give them a guideline to sort of grow back together, leading to up to a foot. Now so that's the technique, but the device, that circular 3-ring device, is known as the Ilzarov device. And it comes from Dr. Ilzarov, a Russian surgeon in the 1950s who noticed this actually on horses. So if you've ever seen a horse with that big arch above its neck in the halter, that's basically what this device is designed after. He treated a Soviet world record holder in 1968 who had broken his tibia and had 20 unsuccessful operations over a 3-year period. Ilzarov used this technique and his device, and it healed the world record holder, and he went on to compete in another Olympics.
Wow.
It was brought to the U.S. in, it was in the 80s, 1987, and here's where I learned about it, by a physician known as Viktor Frankl, who is definitely not at all sounding like Frankenstein for a device meant to grow.
Yeah.
Who was the president at the time of the Hospital for Joint Diseases.
Hopefully his patients weren't as grotesque as his monster.
Yeah, totally.
So he's like, I'm going to break your legs, and then place this device on them, and you will grow.
Exactly. Very nice. Very nice. I do want to say that, if anybody's thinking about this, one, please think long and hard. Is this really something that's a functional issue, or is it really cosmetic? Praz, of course, I'm sure you'll be happy to tell us about the issues with anesthesia, especially when, trying to do orthopedic procedures that are this kind of complex. But, from my perspective, you do have a nail going into the medulla of the bone. That means the center of the bone, and several of these nails holding it into place. When it's medically necessary, like if someone has a bone deformity or they're really short where they can't even at full adult height reach the pedals of their accelerator and brake to drive their car, it's totally understandable, but you're open to infection. And even though with a good physician and good follow-up, your incidence for infection is pretty low, it is still there. So there's kind of this ongoing risk for the months and months and months, not to mention the pain and the aching and the rehab that you need before you consider a surgery like this one.
Absolutely. So aside from the typical complications of infection, bleeding, etc., probably an intermediate risk for surgery, meaning that it's not a simple procedure like taking a mole out, but it's not a high-risk procedure like having heart surgery. Most people who are reasonably healthy will probably survive the procedure. That's a good thing.
Yes.
Yes, you can see where my standards are over here.
Yeah. It's a good cutoff. It's a good cutoff. Yeah.
The biggest issue that I could see with this type of procedure is pain control, both in the operating room and for the next several days afterwards. And I would imagine that the surgeons would request some sort of regional pain control, meaning that if you were going to have this type of surgery, you'd probably need either an injection into around your nerves to try to numb the area that's going in there, or possibly even a catheter placed around your nerve so that you could have good pain control for the next several days. I mean, aside from being uncomfortable, having bad pain control will keep you in bed longer, put you at risk for other complications like pneumonia, forming clot, and everything like that. And that's something that you also had to think about before going into this procedure.
The risks also do include nerve damage, hip problems, osteoporosis at the site of infection. I mean, you are causing a break in a bone. You're really going out on a limb here. So what you have to do. And this is not a cheap surgery at $85,000 on average, and that's how much it is in India, where most people are flying to have it done as an elective cosmetic procedure. Obviously, you would expect that a procedure like this would probably leave quite a few scars, as with any sort of major operation.
Yeah, absolutely.
Well, that brings me to our next story from Medical Press, published beginning of this year, actually, January 5th, 2017, about a new scientific study that may give us the first step in becoming like Wolverine from the X-Men.
Woo!
Oh man, can I grow claws out of my hands? Metal claws?
Oh, so close. I was actually talking about regenerating skin such that you don't scar.
Oh man. Although I guess that's pretty good.
It's not as good as knife hands, but it's a okay silver medal.
It's pretty good. Yeah.
Researchers at the Perelman School of Medicine at the University of Pennsylvania, in conjunction with the Developmental and Regenerative Biology Department at UC Irvine. That is a great name for a department.
It's fantastic.
Yeah.
We name our departments well. That's how we attract people, especially if you have an institute.
Right? Like, I want to work at the Regenerative Biology Department.
Yeah.
Well, they found a study that helps regenerated skin heal rather than scar tissue by transforming the most common types of cells found in scars into fat cells, something that until the study was published was thought to be impossible. And this was published in Science on January 5th, 2017. So fat cells are known as adipocytes or adipocytes or however you want to pronounce it, but they're normally found in all of your skin, not just in those areas where you have maybe a couple extra pounds. But your fat cells are lost when wounds heal as scars. That's why the skin is shrunken, looks dried, it doesn't have that sort of puffy softness to it.
Yeah.
And the most common cells that are found in healing wounds that haven't scarred yet, are known as myofibroblasts, which very often tend to form a scar. One of the other things that these researchers noted is that scar tissue doesn't have any hair follicles. Think about it. You never have hair growing out of a scar. It's just dead skin with nothing. There's barren ground. The earth has been salted. Nothing grows here.
Yeah, it's a very unique type of tissue that is even different from skin. Absolutely.
These scientists found a way to change myofibroblasts, which are the type of cells found in these wounds that usually form scars, into fat cells that don't cause scarring. And the secret is to regenerate hair follicles first. So maybe they're born with it, maybe it's Maybelline, but maybe it's myofibroblasts.
Yeah.
But
maybe they're just...
after you regenerate hair follicles, the fat regenerates in response to signals from the hair follicles. So even your hair can make fat.
Yeah. There's a nice, fat pad next to each hair, and that is actually a little bit of the function of hair. We are not furry apes like our cousins. We are the hairless apes.
Unless you're Indian.
But yeah, unless you're Indian. There's a few of us. We can say that because we are Indian. There are other ethnicities out there, but I don't want to get political right now. There's a little fat pad next to every pilus, and that's a vestige from when we were, in the trees and when, before we were Homo sapiens. So that little fat pad can come along if you program the myofibroblast to make it.
So with that being the case, if the hair follicle really is the key to regeneration, would any of these medications or solutions or creams, like things like Maybelline or minoxidil?
No. You can't Simpsons this. No, so this was actually a tissue and mouse study where they really had to go in and take the myofibroblast, reprogram it, and then replant it into the mouse.
Huh.
So they had to trigger the myofibroblast to behave in a manner that it's not used to. So you can't just like add a chemical and go.
Oh, okay.
So,
Well, actually, what they discovered is a chemical that adds the go, called bone morphogenetic protein. So they went deep. They went deep into these, but Santhosh is right. They were carried out in rats.
Yeah.
You know, this isn't going to be showing up on the shelves anytime soon. But what was found is they looked at these hair follicles that were stimulating fat cells, and they found something called bone morphogenetic protein that instructs myofibroblasts to become fat. So they were thought originally to be incapable of becoming any kind of cell, aside from what they were. You know, like a stem cell can become anything, but most other cells, once you specialize, there's no career changes.
right. Yep.
So what they can do is take this signaling protein that they know exists in all hair cells that helps convert things into fat, use it to stimulate myofibroblasts in healing cells, and it makes a tissue regenerate rather than scar. Now, it may be a little bit hairier, so, you know, now that explains a lot of Wolverine's, shall we say, appearance.
Yeah. He's not a hairless man. And by the way, we are talking about Wolverine, the comic book character, not Hugh Jackman, the Oscar-nominated actor.
Although he's a hair.
I just don't know him well enough to say.
Right. We in the movie watching world have seen quite a bit of him, but you know, we don't know everything.
The end result is Dr. George Costarellis, chair of the Department of Dermatology and principal investigator, is saying, you know, this is very exciting. They want to follow up on this, not just for cosmetic purposes, but also to help treat, you know, the loss of fat cells you see in chronic conditions like HIV, or even to focus on, when we say early wrinkles, a form of anti-aging research. So there's a lot of high hopes, but the important thing is we actually do know how to prevent scarring, even if it's only in rats.
Yeah, absolutely. Wow. And I should say, Josh, at the very tail end of this report that Dr. Costarellis et al. Submitted in Science, they did say that they got some keloid tissue. So keloid scars, ladies and gents out there, is if you ever have you have a tendency to scar where the skin not only scars with the thin tissue, but becomes kind of thick. It does happen more often in darkly melanated people, so African Americans and Indians. They took some of that keloid tissue, keloid scar tissue, and co-cultured it with bone morphogenetic protein 4, BMP4, and co-cultured them with lipid-laden adipocytes alternatively, and saw if they could induce human tissue to do the same thing in tissue culture. So this was on a plate, and actually they did, but certainly none of this was tried in like a living, breathing human.
So now that we've talked about forcing your bones to lengthen and about preventing scarring, I figured the next best study to go into would be one that deals with one of the most frightening parts of the anatomy, your teeth.
Woo! Oh, God.
You know, the part of your skull trying to escape from your face.
Yeah, just
So researchers have found a way to regenerate rotten teeth using a drug normally given to treat people with Alzheimer's. And it's not by giving it to people with Alzheimer's and then they just forget about their rotten teeth.
But
in this case, ignorance is not bliss.
But yeah, so scientists have actually managed to repair cavities by stimulating the naturally occurring stem cells in the tooth to rebuild its own tissue, and that is with using an Alzheimer's drug known as, oh gosh, don't butcher this, Tideglusib.
Right.
Tigluglub.
All right, this is...
Tide Bugles. Oh.
Rein it in, Dvoretsky. This is an antagonist of an enzyme called glycogen synthase kinase 3, or GSK3, kind of a custom molecule which is a GSK3 inhibitor.
This was also trialed on mice, giving them cavities, maybe by having them participate in Swedish Candy Saturdays, which we discussed in our last episode. But they gave a bunch of cavities to mice and rats, and then gave them this Alzheimer's drug, and found that it stimulated the teeth to regrow dentine, which is the mineral component that actually makes the tooth hard and able to chew and bite, and give us that delicious omnivorous lifestyle.
Yeah, that's what you see on the outside when you smile.
So it generates dentine, and I guess that also participates in the enamel.
Right.
But it reduces the need for fillings or cements. And because Tidal Glub Glub is a...
Tidal-glucid.
I feel like it's the Benedict Cumberbatch of drugs. You can really say anything. You could say anything, and you'll know what I mean. I could say, oh, you know that actor, Benedictine Cumberbatch, or Boondock Cabbage Patch, or really any 3 syllables, and you'll know who you're talking about.
Yeah, that's the guy. It's Sherlock, damn it. Come on
That's
now.
my goal in life. To be able to be referred to by.
Boomer Cucumber Head, Anyway, so Tideglisib was studied. Ironically enough, these findings were made by the Dental Institute at the King's College London. They were using these clinical trials to treat neurological disorders, and happened to notice this separately and started a separate trial to follow up on it. Interestingly enough, this could be fast-tracked even within the next year or two, because Tideglisib is already an approved drug.
Right.
So it doesn't have quite the same hurdles. This would just be a new application of it, so a new on-label use. You could see this even as early as next year.
Yeah. So GSK3 inhibitors were studied for a long time in Alzheimer's, and Tideglisib specifically had been trialed, and it had been kind of moving along. But this enzyme, GSK3, is not exclusive to the central nervous system. So, as it is in a lot of, fields of science, a scientist will be going through maybe a journal watch or looking for a molecule that they're interested in this case GSK3, and they might actually stumble across, we have a GSK3 antagonist now, which is already licensed for use or in clinical trials. And I say, hey, I deal with GSK3 all the time. I'm a tooth expert, but I wonder if this would work on dentine rather than on Alzheimer's symptoms.
So the good news is, even if you start ending up forgetful, you'll have a winning smile.
Ha!
There you go.
And that concludes this particular episode, or this week's medical topics. But let's throw in a fun just the tip. What do you feel about construction machinery? Bulldozers, cranes, dump trucks, things like that.
I appreciate them for what they do. I am into heavy machinery in terms of wow, man, that's really, really cool. But I don't know anything more about them, to be an enthusiast or what have you.
Yeah, I'm definitely not an enthusiast, but again, I think they're cool. What they do is certainly impressive.
Well, good news for both of you, because for people who are interested in, want to learn about, and enjoy and interact with construction machinery, there is an entire theme park called Diggerland.
I never.
It's in New Jersey. Of all places. Of course, because it's in New Jersey, the very first ride that you can go on is known as the Backhoe Adventure.
Okay.
Ready to drive? Ready to drive? Take a backhoe adventure when you, 3 friends, and a Diggerland ride operator climb inside the cab of a modified JCB 3CX backhoe, taking turns behind the wheel of the machine as it navigates our obstacle course. So this is actually, it's a family-friendly, and I should be fair, primarily aimed at children theme park.
Okay.
where the adults are allowed to participate, and you get a chance to drive obstacle courses and operate things like cranes, skid steers, shake and rolls, those asphalt rollers that pave the way. You even get to do treasure hunts with cranes in sandboxes and trying to use the arms on bowlers to actually go bowling with construction machinery. So for only $36 a day admission, it seems like a great way to kill a couple hours.
Nice.
And it is meant for all ages. So I know we go internationally often, but I feel that really we have to recognize our nation's treasures.
Just keep in mind, if your child is 36 inches or under, they can have bone lengthening surgery so they can participate.
Oh, yeah. Let's boost them up. Nice.
Excellent.
That
Excellent
was a
call.
fantastic segue. That's a good tag right there.
You know, I think we should end it there, but I do want to give a special shout out to our Patreon patron, Rebecca Gamble. Thank you so much for your generous donation helping to make this show ever better.
We love you.
And with that, cut to our outro. As always, we love to hear your comments, questions, and feedback. You can reach us on Facebook, on Squarespace, on Twitter, on Patreon, anywhere podcasts are downloaded. We'd love to hear your reviews, your ratings, and we would love for you to support us spiritually, emotionally, and financially. Included in the show notes are a whole bunch of places you can do that. Our theme music is composed by Rachel Leisure. This show is produced by me, with a lot of help from all my co-hosts and those of you who submit stories. Thank you very much. And until next time, as always, happy travels.
Bye, guys.